Welcome to Queer Town Hall, Trans Healthcare Edition, Trans and GNC Healthcare Focus tonight. So my name is Nancy Hawk. I'm the Executive Director of Basic Rights Oregon, and I'm really excited to have a panel of experts with us tonight, and really excited to answer all of your questions. And so the way tonight's going to go is I'm going to start with a few questions for our panelists. And then you will have a chance to ask questions through YouTube comments or on the Facebook Live feed. And so a little bit about tonight and a little bit about, I guess, Basic Rights Oregon. So we're the state's political advocacy organization, as you may know, because you joined this call and this broadcast, but we have been fighting for LGBTQ rights in our state since 1996. And Queer Town Hall is an event that we're trying to have every week to get you the information that you need during this pandemic and during this crisis. And at the start of the COVID-19 crisis, we sent out a survey to the LGBTQ community saying, what's happening for you? What are you needing? What are your concerns? And almost 10% of our respondents said that that either they or their partners had a delay in receiving gender-affirming care. And we know that for many of you, you've waited years, maybe your whole lifetime to receive that care. And we also know that our hospitals and our doctors have to weigh the health of everybody and what's safest for everybody right now. And so there's a lot happening. And so we also know that people in our community have lost employment, and you might be applying for the Oregon Health Plan for the first time. So we're really pleased tonight to have folks from the trans healthcare programs at Legacy and OHSU and representatives from the Oregon Health Authority to answer all of your questions. And so with that, we're going to go ahead and get started. And I'm going to start by asking everybody to share their name, their pronouns, the organization you work for, maybe what your position is there. And then just for fun, one thing that surprised you in a good way during this time of social distancing. And I'm going to go alphabetically and start with Amy.
Hello, good evening. My name is Amy Penkin. I use she and her pronouns. I'm with OHSU with the Transgender Health Program, and I'm the program supervisor for the Transgender Health Program. And something that has surprised me during this last month or so is how many people I've encountered who are friendlier because they're in some ways slowing down. And when I take my dog for a walk, everybody says hi to each other, and I wish it was like that all the time.
That's great. Thank you. How about you, David?
Hi there. My name is David Ballantyne. My pronouns are his and he, and I work for the Oregon Health Authority. I assist the CCO operations team. I have a background, though, from the Oregon Health Plan call center for many years. So I spent a lot of time there in customer service as well. For me, the biggest surprise has been a fun one for me. I'm an avid record collector, and so I've gotten to spend a lot more time listening to records as I work on emails and things like that. So it's been really fun to move through my collection.
That's great. Thank you. Ellen? Oh, you're still on.
Thank you. My name is Ellen Tinney. I'm the principal ombudsperson for the Oregon Health Authority. And our job is to be advocates for our clients. And I just want to say how much I appreciate Basic Rights Oregon and the work you do on behalf of our clients. And let's see, I think probably the fun thing I've noticed during this time is how and where people build community in places they haven't built community before, even if that community is 6 foot distance, how it is people are connecting.
It's wonderful. Thank you. Hayes?
Hi, everybody. My name is Hayes Young. Pronouns are they and them. I manage the gender and sexual health program for Legacy Health Systems. I think the thing that surprised me most, although I think I knew this would happen, is just how incredibly creative people are getting with connecting with each other without having that physical distance. Is they're still socializing. We are still socializing in some really unique and amazing ways.
Lovely, thank you. Jess?
Hi, everyone. I'm Jess Guerrero. I'm a social worker at OHSU's Transgender Health Program and do most of the patient-facing activities. I use they, them pronouns, and the most surprising thing, I'm going to pick two about this quarantine and social distancing, is that I can run 3 miles. No one, I'm as surprised as everyone. And that despite having to keep distance, there's been this really amazing kind of swell of support and connection in my neighborhood, especially for parents of young kids. So.
Lovely, thank you, Jess. I'll say I'm surprised that I did not forget how to ride a bike. It seemed shaky at first, but there I was for the first time in a decade, riding my bike. And just, is the spring always this beautiful? I don't know, but it feels extraordinary this year. So I just really want to take a moment to appreciate the wealth of experience on this panel. I've worked with many of you for many years and relied on your brilliance to fight for trans healthcare. And this is really an honor to work with all of you tonight. So I think let's start with Legacy and OHSU. And if you could just, for everybody, share an overview of the services your program typically provides and how those services may have shifted during the COVID-19 crisis. So why don't we start with OHSU?
Okay. So OHSU has been providing gender-affirming care across the lifespan for solidly under the umbrella of the Transgender Health Program for the last 5 years. But in primary care and pediatric settings, we've been caring for trans and gender diverse folks for probably closer to 10 to 12 years. In addition to offering primary care and hormone therapy, we do have a comprehensive surgical program offering the full spectrum of gender-affirming surgeries. We also have other medical services such as voice and communication training, hair removal services, and we've added behavioral health services in the last year. We also provide support through care navigation, information and referral. We teach patient education classes. We host a community advisory board, a volunteer program, and a monthly meeting, which is called our Transgender Health Community Meeting, which is held every month and open to the public. In terms of changes over the last month since the emergence of this pandemic, all of our clinical services, such as primary care, hormone therapy, surgical consultations, all of those have moved into telephone or online virtual visits. So those would be video-based visits. Any urgent visits that for patients who need a physical examination or patients who had surgery recently and require physical examination, that care is still taking place in person in the clinics when those are necessary. We have suspended temporarily our surgical program. We suspended our hair removal services, and we suspended our patient education classes. But most everything else is continuing, just in new, creative, innovative ways to make contact with our patients however we can.
That's great. Thank you. Hayes, do you want to talk a little bit about Legacy's program?
Yeah, the Gender and Sexual Health Program at Legacy serves 8 hospitals as far north as Southwest Washington, down toward Salem, out toward the coast, toward Hood River. We have dozens of clinics within that. In our program, we do a lot of oversight of the system itself because it is so geographically large and culturally very diverse across all of those hospitals and clinics. So a lot of what we do is education of those providers, of the staff in those clinics and in our hospitals, But additionally, there's some other things very similar to OHSU that we have a decentralized model, meaning there's not necessarily just one clinic where people are seen, of primary care for transgender diverse people that can or not include hormone therapy, and then gender affirming procedures. We have multiple surgeons in-house, but we also have a collaboration for the last year with the Meltzer Clinic in Scottsdale, Arizona. So we have changed up in the last year how many surgeries we're able to offer at Legacy. So I think similarly to OHSU, really the only thing that has been uniquely impacted are actual surgeries for gender affirming procedures. Those have been delayed or have been potentially rescheduled for an unknown date. And I know we'll talk a little bit more about that. But some of the other things that we do in our program is we have a mental health outreach worker who interfaces with Unity Center for Behavioral Health and with our medical emergency rooms for people who are dealing with mental health crisis. And that outreach worker specifically works with transgender diverse people who are dealing with mental health crisis or coming out of an institutional space like that. We have a lot of similarities to OHSU. I really love that we have so much overlap in the ways that we roll out work. And very similarly, I think you'll find in most health systems, especially in a lot of clinics are still operating, as so much has gone to telehealth, whether over telephone or video call, with some things still happening in the clinic, depending on what your doctor is needing to know from you. If you need an exam of some kind for them to work with you, then you may come into the clinic. But everything else, we're trying very hard to limit the amount of traffic that's coming in and out of clinics and hospitals.
That's great. Thank you, Hayes. And now for OHA, many new folks are applying for OHP right now or will be in the coming weeks and months as the economic impacts of this crisis unfold. Can you give a little bit of coverage, a little bit of an overview of the coverage the Oregon Health Plan usually provides for gender affirming care and how, if at all, that coverage is being impacted by the crisis?
Yeah, so this is Ellen, and I hope that folks on this call got the guidance from the Health Evidence Review Commission, which is the body that's charged with developing a diagnosis treatment paired list. And one of the guidances I asked folks to have a copy of is actually their guidance on, it's called Guidance Notes on Gender Dysphoria. And it lists, as you all can see, if you open that up with me, all of the ways that gender dysphoria and reassignment surgery and other related surgeries and services are provided, and their guidance includes criteria. I want to emphasize that regardless of whether new members or current members are in one coordinated care organization, which is what we refer to as health plans, or another, all of our clients are supposed to be able to access the same care and the same services. There should be no difference in how it is people experience the receipt of these services. And we also have a fee-for-service program where the state pays directly for services. The fee-for-service program is also supposed to be providing access to these services. As I said earlier, I appreciate all of Basic Rights Oregon's advocacy. I believe that's why we have this particular service available to all Oregonians. And I was the ombudsperson when it first came online, and I was getting calls saying, now where can I find a doctor? There's only one doctor doing these surgeries, and this doctor is only accepting cash. I have to say we've come a long way since then.
Yeah, it's been many years. I know that a lot of people in the trans community and fought for that coverage in OHP, including people on this call, folks like Hayes, who've been there for a long time. And it's been amazing to be able to expand services to people receiving OHP. And do you think there's been any change in coverage since the or impacts of the COVID crisis? on coverage?
I would say that just as we heard from Legacy and Oregon Health Sciences University, and we currently have a number. So just putting that out there, the Ombuds program is available for folks who need help navigating the system. I will give our toll-free number before the end of this call, or now, as you wish. Our experience is that surgeries are being delayed or being postponed because of the reasons that have already been identified. I understand this to be related to the lack of availability of personal protective equipment, and I believe that all of us need to work together to support our provider community and our state to serve folks that may be coming here to the system because of COVID. I also believe this is a great time to be doing all the work that needs to happen to be ready for surgery when and if when surgical centers open back up again. So what we've seen as an Ombuds program is clients calling us saying, why was my surgery canceled? And we have to explain exactly what I just explained and what OHSU and Legacy shared. And we always say, it doesn't mean you should give up. You have a prior authorization process you can go through, and you should go through that process and get everything ready for the time that surgeries open back up again.
Well, thank you, Ellen. Perfect segue for my next question, which is for everybody, which is really to all those folks who are listening. What do you think community members should know about the pause on gender-affirming surgeries, both in terms of the procedures themselves and in terms of insurance coverage? And I'll leave it open to, you can raise hands or you can maybe just start talking. I feel like we're a polite crew. Amy Penkin.
This has been the question of the month, really, is how do we minimize disruption and prevent long delays? And I think this is why we have focused so much right now on moving towards, as much as possible, virtual visits. And I think in terms of, obviously before a surgery takes place, there has to be a consultation with the surgeon. So we wanted to try and increase our capacity to continue those consultations and moving those to telephone or online. We also only canceled surgeries in small chunks rather than saying we're going to cancel all the way through the end of the summer. We just canceled through mid-May because that was the duration of time that we thought was likely to not be able to proceed. So we're still trying to determine how we're going to be rescheduling and giving priority to those who've been scheduled during this, who were canceled during this time. We're not going to have anyone who's been waiting for consult or surgery that was canceled to have to go kind of back to the end of the line, so to speak. Those folks are all going to be prioritized for rescheduling when the ORs open back up.
Hayes, or does anyone else want to? Yeah, go ahead.
Yeah, I think a really key thing to know about the delays is that all of our programs, and we have several health systems that also have surgeons, including like Kaiser, who are not on the call, is that I can at least say for our system, I feel like I really believe this in OHSU and other systems, is that all of us wholeheartedly agree that gender affirming surgeries are essential, are important, and are life-saving. When we use a term like elective, that means it's planned for. It means that we have some planning for that. We do not see these surgeries at all as cosmetic. And so it's very clear, I think, to know that we're not really comparing apples and oranges here, because people who have been in pain, for 30 years, who need a hip replacement, they're not getting hip replacements. Or, it's the only surgeries I know that are happening in our hospitals right now have to do with like new cancer diagnoses or people who have, cancerous tissue that has to come out. There's some of those things that like we're really having to consider. And even those are considered very, very carefully because of the use of things like masks and goggles and gloves and gowns. if anything happens with your breathing during surgery and you have to have extensive measures done that can aerosolize, which means a lot of us have been reading the scary news stuff, right? Of like about aerosolization. You don't want to be sick when you have had any surgery. But like I think about when we talk to patients all the time who have had chest or breast surgeries, and we're like, we need you as well as possible. You don't want to be coughing when you have had really large incisions on a place that's going to be impacted, right? Your healing is wrapped up in this. So one is to keep in mind of that, like we're all fighting for everything to maintain. And also we very much have in mind the health and wellness of our communities who have fought a long way to be here, to be alive, to be waiting on those lists. And then I think the second thing to keep in mind is that, you know, almost all, but not all, almost all of patients who are having surgeries, gender-affirming procedures, are having them at OHSU or at Legacy. Kaiser patients do have their procedures at Kaiser. All of us have programs that include social workers. And what that means is maybe it's time to revisit your care plan for when your surgery does happen. Maybe that person who was going to fly in from the East Coast to take care of you for 2 to 3 weeks is maybe not going to be able to do that because they lost a job, or they won't have travel time, or they're not sure about booking travel. So keeping in mind there's stuff like that that you might have put on your care plan that might have changed because of this. And, you know, speaking for, I know Amy and Jess at OHSU, our social worker Willa, you know, Heather and Izzy who are at Kaiser, everybody really wants to talk to you. Like we would rather talk to you on the phone and get those things in place and have you ready to go the moment that we can put you on the schedule.
Thank you for that and for providing that context. I think it's really important for folks to know, and what amazing advocates we have working in our healthcare systems.
Can I say one?
Oh, sure. Please go ahead, Ellen.
I just wanted to say, I think your question is so appropriate and important to read because it says this is a pause. It is a pause on surgeries. It is not a cancellation. And during this time, which we're going to hear about later from David, the need for gender-affirming surgery does not and should not impact your insurance coverage, and your insurance coverage should not be impacted during this time. So you're going to hear later that the Oregon Health Plan is not terminating anyone from coverage at this time unless certain conditions apply. And the insurance commissioner, private insurance, has said no insurance policies can be terminated because of inability to pay. So insurance coverage is going to continue. This is a pause in surgery, and how it is we pick up the ball after this crisis is over and hospitals and systems prioritize surgeries coming into no COVID is really what we all have to keep our eyes on.
Great. Nancy, can I jump in for a second too?
Sure, go ahead, Jess.
Okay, great. I just wanted to talk briefly about the pediatric world. I'll speak to OHSU, but I also am in close communication with Clancy, who's my counterpart at Legacy. Both of our programs, and we'll give you a bigger update in a little bit here, but both of our programs have largely continued as usual because of the leadership of Dr. Kara Conley at OHSU and Dr. Karen Selva at Legacy, echoing what Hayes said in terms of the belief that this is essential care and not cosmetic or elective. For our pediatric patients, if you're listening or if parents are, if you were on the schedule for surgery, and I know that a lot goes into that in terms of school years and graduating from high school and launching into adulthood, please get in touch with us as you're trying to figure things out. You know, we can be advocates within our system. No one's care is prioritized over anyone else's, but where there is some flexibility due to life circumstances, we want to support that because we know that young people do better when they're plugged in with their natural support systems. And then finally, we've really worked hard to keep up our relationships with community organizations like Transactive and PFLAG, as well as primary care providers and community mental health providers, to make sure that we know what the status of care is around the state, and that care can be coordinated as seamlessly as possible as folks are coming into clinic with us.
Great. Thank you, Jess. So we've actually already gotten 3 questions. And so I know that people have been just waiting for this to get access to all of you. So the first question is from a very well-informed person who's asking if OHSU and Legacy are going to start scheduling gender-affirming surgeries after the OHA memo came out. So does anyone want to take that on? Feels like a hard question, given that folks have already spent some time explaining why things are on a pause right now. But Hayes, you look like you might be ready to jump in.
Sure. Yes, I'm not remembering what side my microphone is on. What I will say is at the time is that no, and this is a no, and we've already started evaluating what's possible for the different kinds of surgeries that we have coming in-house, to see how many supplies are needed, how many people do we have, how quickly can we have somebody come in and out of the hospital, because all of our hospitals do have COVID positive patients. We have folks who are coming in and out, and staff who have been redeployed, meaning they're working in a different area than they usually work. Is we're having to look at, do we have the resources in place, not now, but like in 2 weeks or in 3 weeks or in 4 weeks. We're having to look literally every day changes. I think I would guess that that's the same at all of the health systems. So it's sort of like no, and because we don't want to start scheduling people and then say, oops, we did that too soon. Actually, we're going to have to delay you again. Because I mean, I don't want to have that phone call with people to say, congratulations, we have a surgery date for you in 2 weeks. And then next week I have to call again and say, I'm really sorry that I got your hopes up. We're not going to be able to do surgery after all. And part of that is because I think for our system, and I think a lot of healthcare systems, is that the predicted peak of cases, we're still about a week away from that peak. So there's a lot, there's a lot that we're relying on with modeling of the data to know how bad is this going to be. And I think that our social distancing, our physical distancing, good job, everybody. Please keep doing it. I know we're all like finding new ways to exist. I think that we will know a lot more, I feel like, in the next like 7 to 10 days about what our supplies will look like, because right now we're gonna miss the worst of it, which is still bad. Like, we still have really suffered some loss and hardship in Oregon. We have not seen the numbers of New York, and that doesn't mean that we're not also exhausted and still trying to figure things out. So I appreciate the information in the order, and this is one of those things where we have to decide, how many patients do we have coming in, how many resources are needed for each of those people. And that includes people, that includes gowns, gloves, goggles. You will not believe the amount of gloves that one patient can take up, just in a day, like in a 12-hour shift for nurses. It's amazing. And at first, when we started this, I was like, no, we're not going to cancel these surgeries. Like, we can't, like, these are important too. And then I spent the day in the hospital understanding and watching how many resources were being used per patient. And I was like, I don't want any of our patients to get sick. I don't want their family members to get sick. I don't want the people taking care of them to get sick. I don't want our nurses and our CNAs and our anesthesiologists to get sick,
Mm-hmm.
So I think at least for Legacy, it's a balancing a lot of like anxiety from patients, anxiety from us as healthcare providers and workers, and also knowing that we still have some unknowns. We can plan for everything and still come up short on stuff. So it's not the answer that I want to give people, but it's real. I think it's the reality check of where we're at.
Yeah. Amy?
I would echo everything that Hayes just so eloquently described. The one thing that I think we will be looking at is how we're going to make determinations about surgery depending on the type of surgery. When we do start phasing them back in, some of the surgeries that we offer are shorter surgeries that usually are done just as a day patient where someone doesn't need to stay overnight, and other types of surgeries require an inpatient stay. And I think that will have some bearing on how we move forward with surgeries based on what the resources are that are available. And I agree also with Hayes that the data is yet to come in terms of the modeling that was forecasted, and just to see how our supplies endure. And as we have guidance from our leadership in each of our systems, there's a lot of collaboration that's happening between our health systems. We're going to find ways to get those messages out into the community. And for anyone who has questions for wherever you are accessing your care, we really do invite you to get in touch with us directly, and we can tell you what we know as we know it.
That's great. Thank you.
Nancy, can I just say something here?
Sure, please, Ellen.
Yes, that I'm reading from the new guidance on elective and non-urgent healthcare procedures. If folks on the call have not gone to the COVID-19 webpage that has been put up, I really encourage you to go there. There is a special link for providers. There's a special link there are a number of links there, but the one I'm reading from is from the guidance on elective and non-urgent healthcare procedures. And the question that providers asked was this: can I provide essential reproductive health services? And the statement is yes, abortion, family planning, and gender-affirming care are time-sensitive services. If canceled or delayed, could be considered to result in irreversible harm and can be provided. So I feel like that's a pretty clear statement to the system itself that they are being asked to make decisions about whether delay of a service or a surgery or a procedure would result in irreversible harm and can be provided. And I appreciate the advocacy that's going on around this.
Thank you, Ellen. So there's a question about letters, which I know was being discussed before the broadcast of this call even started. So if 2 letters from mental health providers were required and will expire in May or June, will OHP and OHA require that patients go through the entire process of getting letters rewritten if their surgeries were scheduled to happen in April or May and got canceled? Amy?
I can't answer on behalf of the health plans in terms of determinations they make about letters that are expiring. But what I can tell you is that we are keeping a list of all of our patients who are scheduled for surgery and keeping track of the authorizations and making sure that we're in touch with health plans to ensure that those authorizations don't expire and that we ask for extensions. And part of that, we would be advocating for not requiring additional letters because we have the letters in the time frame that we expected for when surgery was scheduled to occur. That being said, kind of hearkening back to what Hayes was describing earlier, it's really important to us to make sure that when we start up surgeries again, that all of our patients are well supported, have good recovery plans, and we want to be working with our patients to ensure that they've got the support that they need as they move forward.
And this is Ellen, and this is where the Ombuds program could come in, could be helpful if clients are experiencing problems in getting their surgeries that have already been approved and problems related to the letters. Really, and I've worked with Amy before on cases that our program is set up to be a client advocacy program. I would really ask folks to contact the Oregon Health Authority Ombuds program. I'm happy to give that number or send it to the facilitator so you can have it. But I really do encourage folks to get in touch with us at 877-642-0450. You can also, we have a web page and you can find an email address there. Not all CCOs treat this process the same, and we want to identify outliers and make sure that everyone is following the intention of the requirement that gender affirming services and surgeries are appropriately provided.
Thank you. So there's a few OHP questions, some of which are yes, no. So someone has an Oregon Health Plan through Pacific Source, and they're wondering if Pacific Source covers care at OHSU or Legacy.
The Pacific Source plan typically will cover at Legacy. However, prior to the world upending, we have in all of our different plans been looking at how our plans can be accepted at other facilities and if that's possible for that negotiation to happen, especially because not all of our systems offer the same procedures, and it's helpful for people to have possibility of having different surgeons to choose from, you know. So for having to say you can only come to this one system means that you may not be able to get consults with different surgeons, which is something I know that all of us encourage people to do, is see all the surgeons that you feel like you can so that you can make an informed decision about who you want to work with. Not every surgeon's going to be great for you. So for right now, if you have OHP Pacific Source, I would say contact us at Legacy at the Gender and Sexual Health Program, transhealth at lhs.org, or 503-413-5600. I know we'll rattle off a bunch of phone numbers and somebody's going to type them up real quick.
Yeah.
But you know, just give us a call. We can at least help you get started and talk about it. And if you're like, actually, I really wanted to go see a surgeon over at OHSU, still talk to us and let's see what kind of advocacy we can work on together.
That's great.
Yeah.
Jess?
Yep, I'll echo what Hayes said for OHSU. Pacific Source through OHP, or OHP through Pacific Source, works well with our system in virtually all of our specialty services. Primary care would be obviously more difficult, but we can always explore that. And we also believe in patient choice and good fits and trust between patient and provider. So you can also contact us at transhealth@ohsu.edu or 503-494-7970, and we'll give you the information about all the possibilities and how to navigate each system to the best of our knowledge, and hopefully get people moving forward on what the next step is for them.
Great. Thank you, Jess.
I would just add that
sure, Amy.
That Hayes and Legacy and our team and Kaiser Providence, we've all worked well with each other for quite a while. So if we're talking with a patient who says something about what they're looking for, whether it's a clinic that's geographically close to them or a particular approach to a particular procedure, if we know that we can't offer it, we will readily give the numbers and names of contacts in the other systems and refer to those folks, because we want patients to be seen in the places that are going to best meet their needs. So we do a lot of cross-referring to each other. So if you call one of us and you're not getting what you want, we're going to help you get to the person who's going to get you closer to what you want.
Great. Thank you, Amy. Now I have two hair removal questions. One, does OHP cover hair removal and electrolysis for trans folks? And two, is progress being made during the lockdown on getting additional electrolysis providers credentialed with insurance providers? Who wants to talk about hair removal?
It is my understanding that that would be part of the package of gender affirming surgeries that OHP does provide. I've actually worked with someone on this call related to that exact issue. And very good question about getting additional providers credentialed during this time. I do not have an answer for that. Oregon Health Plan has its own process for giving providers provider numbers, but it's up to each CCO to credential their own provider network. So it's a very good question, and I think I heard Amy and Hayes and Jess probably mention earlier that this is a time, it's maybe a downtime for surgery, but it's the right time to be asking these questions and to be working on other aspects of care that we can all get behind together. So appreciate that question.
I want to complicate Ellen's answer just a little bit. With hair removal or reduction, it's actually a two-part answer. Yes, it is included for surgical site preparation. So if you're having vaginoplasty, phalloplasty, etc., is that you have to have hair removal for that tissue to be used during surgery. One of the biggest questions that we all get is about facial hair removal. It is officially not in the policy. It's something that we very much want to see in the policy with an absolute on coverage, but there is an exception to rule process that takes a little bit longer, is not a sure shot, takes some additional documentation, some additional work, but it's something that we're interested in pursuing. The second question about getting more folks credentialed is, I can really only speak specifically for like the OHP Pacific Source plan, because that's the plan that Legacy works with closest. Is we sent the names of 4 or 5 electrologists in right before, again, the world turned upside down, and to be added to the provider panel for OHP Pacific Source. And like Ellen said, it's up to the different CCOs to have folks paneled, but it's also up to the electrologists to be open to taking those fees and the reimbursements. And sometimes these are small businesses, I think, that sometimes can't necessarily do that. And we also have a lot of electrologists who work very hard to keep their rates as low as possible if somebody needs to pay out of pocket. But with OHP, we know that there's been a lot of lines. There's a lot of wait times for hair removal, and everything is sort of a fine dance, especially for surgery preparation. So it's a no and yes, no and yes. You said there were yes and no questions, Nancy.
Yeah.
So I just want to make sure that folks know that if they are being denied a surgery that they think is important for their health and well-being, the CCO is required to send what's called a notice of adverse benefit decisions. That gives people the right to appeal that decision and to request a hearing. And whenever anybody tells me they've been denied a surgery or a procedure or a treatment or a medication they think is important, I really encourage them to use that pathway. It's really important for our state to understand the issues that people are experiencing in terms of denials and to address any inequities in how those services are being provided across CCOs.
Thank you. So we've gotten a little pushback around the pause, and people have some questions about it, and also some statements. But I think that there's a little bit of question about if you can get out your crystal ball, if there's a projected time where things might possibly go back to normal with having surgeries. And if it's not a specific like date, maybe like how flat does our line have to be for things to go back to normal in healthcare? And why don't we take that one on first, and then there's a second part. Amy?
I sincerely wish that I could say, here's the date that things would go back to normal. And I think because we still don't know what things are going to look like even a week from now, we have to be prudent to assess what the risk factors are, including what our supply is of personal protective equipment for our workforce and for caring safely for our patients. And I think that part of those decisions about opening back up the operating rooms, we have our surgical and medical director at OHSU that will be in contact with our chief medical officer, who's going to be driving some of those decisions within our system. And what's leading all of this is going to be around safety. And we wouldn't, I think Hayes said very well earlier that if we said, here's the date, and we went for it before we had all of the information, we would be at risk of creating disappointment by saying, well, we thought it was going to be this date and now it won't, we're going to have to extend it further. So we really are erring on the side of caution, and we are doing daily dashboards about what our personal protective equipment supplies are. We're doing daily dashboards about the number of patients that are being tested and admitted to the hospital. We're doing daily dashboards about how many are discharging from the hospital. So these are all things that are being analyzed and looked at. And right now our numbers are still going up. We have not seen it start to decline. So it's really difficult to predict planning for a surgery when we are still seeing increasing numbers of COVID cases coming into our system.
Yeah, I think, Nancy, you were talking about like how flat does the line need to be. It's not necessarily about how flat the line needs to be. It's about what's on the other side of that peak or plateau. Is because what we really have to look at is how many people are needing hospitalization and how many people are going to be in hospitals. Because if we look at cities like New York, is like entire hospitals are being taken up, right? Or the majority of hospital space is being repurposed for intensive care, for a lot of respiratory care, things like that. What we're hopeful for is that even though the tests are increasing, that doesn't always tell us how many people are going to need to be hospitalized. And when we do surgeries in a hospital and we have COVID patients who are being hospitalized in those hospitals, we're having to put sort of those two things next to each other. That's why I keep thinking about, okay, if it's about 7 days or so from now is when we are supposed to see a peak of hospitalizations and what the numbers are going to be, that's the day that I can say, or the day after that is the day that we can start saying, okay, can we have a plan A, a plan B, a plan C for reopening those services? We will all, our team, we will already start talking about it next week, but we're only talking about it next week to be able to say, okay, scenario A is this, scenario B is this, scenario C is this. So we can see if all of these things align, then we can open up this time. So my ask to folks in community is please be in touch with us, even if you're feeling anxious about it, or if you call us every day to say, is today the day? And we'll be probably really gracious and say, today's not the day. And I wish it were. And I mean that with everything in me. And also, what's something else on your care plan that we need to revisit? Or what's something else that's going on? I see that your insurance did change. You lost your job, it looks like, and now you're on OHP. Let's just kind of talk about how that might affect the rest of your care, so we can get literally every duck possible in a row before your surgery happens. Yeah, it's not the. I mean, none of us want to give these answers at all. Right. I want to be like this date and time, and I think that would be like really kind of crappy of us to say, here's the date. And then our community is like, okay, this date is the day that we're all going to start having surgeries. And then we're like, no, just kidding. Sorry. I led you that.
Jess?
Yeah, I just want to acknowledge that, and you've kind of said this, Hayes, but that the waiting game is anxiety provoking. And as a community that has been failed by the medical system many times over, not having an answer I can appreciate feels like a failure right now. And on the flip side of things, being in a system and communicating directly with patients and their families, and then with my colleagues who have had to make the awful calls to cancel surgeries in this time period, this doesn't invalidate the anxiety that folks are feeling, but a lot of the feedback that we got from folks was actually a bit of relief that they didn't have to make the call themselves about their own personal safety coming into a hospital system in the midst of a pandemic. Of course, when their surgery was postponed, the immediate question was, when's my date? But there was a sense from some folks, not everyone, that there was a knowledge that physical health safety was being taken into account as we went through this process.
Thanks. I'm going to read a question, and it's a comment word for word because it's someone who has sort of a different view. of dates and scheduling. For the mental, emotional well-being of your patients, can you please reschedule their surgery dates for a concrete time in the future? Even if you have to reschedule them again, as the time draws near because it is still not safe to proceed, it will affect their mental health in positive ways, knowing that you're working to make sure they receive the surgery they've been waiting years for, as soon as it is all safe to do. Indefinite postponement is leading to depression, self-harm, and suicidal ideation. And I know that's heavy because I know all of you are very aware of the mental health effects that postponed surgery can have. And so, and I know we've already talked about this pause a lot, but I just wonder if you want to respond to the person who asked this question. Let's go Amy and then Ellen.
I really appreciate the comment and the question, and I would feel compelled to be able to do that for anyone who wants a new date. My worry is if we schedule a lot of new dates, it takes a lot of time for our staff to do all of that scheduling and to do then subsequent cancellations. And I think staff time right now is being directed towards the authorizations and maintaining those authorizations and working towards care plans. And I would be a little worried about trying to do all of those things without dropping the ball and creating worse problems. So I would, what I would really like to do is for the individuals who are feeling more distress, I'd really like just to spend time talking to you and seeing how I can support you through your distress. And if you don't want to talk to me, I'd want to work with you to figure out who can I get you connected to talk about it. Because having a new date and canceling it and having a new date, I mean, in some ways it might give you hope, but I would worry about it giving a false hope with a worse disappointment later. So that's just my immediate thought on that. And I'm so sorry for the distress that so many people are experiencing and the disruption that so many people are experiencing. It's a really, really harmful consequence of our current state with this pandemic. And as everyone has already echoed, it's painful, and we hear the pain and we hear the distress that's coming from that.
Thank you for that, Amy. Ellen, did you want to add to that?
Sorry about that. I'm trying to figure out my technology. I really appreciate how Amy presented what she just shared. I want to say that the Ombuds program has really been hit with a number of calls from people who have shared they've never felt they needed mental health, that they're under a lot of stress, they need help figuring out how to get there. The flip side of that is we've also gotten calls from mental health providers who've never before served Oregon Health Plan members who've said, we're losing our privately insured patients and we want to be able to continue seeing them. What can we do to sign up to be an Oregon Health Plan provider? I really want folks to know that a lot of barriers to telehealth have been lowered and reduced, mental health inclusive. So I hope everybody knows how to access their plan and the services the plan provides, and to ask questions about where they might be able to connect with providers. Also, to Amy's point, that we're all in this as a community. Every single call we get is a new learning experience for me and for our team. One of the things that I would encourage folks to look at to understand how community-wide this is being how deeply our community is experiencing this and trying to respond appropriately is, again, our Oregon Health Authority COVID-19 webpage, which has a link to the current situation in Oregon, including hospital preparedness. That information is updated regularly. So you can actually see what, I forget if it was Hayes or Amy was talking about in terms of the readiness of our institutions to be able to serve the potential volume of cases that might come in needing respiratory care.
Thank you for that. And I'll also add that we want to have a forum like Queer Town Hall again in a few weeks, where we really focus on mental health and accessing mental health care, and support during this time. We know that this is a very difficult time for a lot of people. And I'll just share that, yesterday we got notice of someone leaving us money in their will who took his own life at the very beginning of this crisis. And my heart just broke. And I just feel like I just worry about our community and how hard it is for folks who are feeling isolated and alone. And I want to make sure that everybody listening knows that we're all thinking about how we're providing all the services that are needed for the breadth and depth of our community, because we want to keep you here, and we want you to be alive, and we want you to be okay, and that we're all fighting for you. So let's just take a moment to shift. And someone asked a question about how folks in rural Oregon can get connected with gender-affirming providers. Jess, and then Ellen.
Yeah, so we are a statewide resource. Even if you never come through our doors, we are tapping into recommendations we get directly from patients who come for specialty care. We've participated in regional trainings in Central Oregon, Southern Oregon, Eastern Oregon, and through those capacity building trainings, we maintain resource lists, and both our team and Hayes' team are regularly kind of cross-referencing with each other, and we've said this many times, although we're in separate hospitals, we really see ourselves as one system working to help out our communities here. And there's no sort of proprietary ownership of these resource lists, and we'll reach out to each other if someone says, hey, I need a provider in X town or X city, and we don't know of one. So that's one way to do it. Brave Space, which is a wellness collective up here in Portland, has a resource list on their page that has some physical health and mental health providers in rural areas. So that's a good list to turn to as well. And I'll kind of leave it at that.
Thanks. Ellen, did you have some?
Yeah, I thought what Jess said was spot on, but clearly if folks have a coordinated care organization that they are members of, one thing they can do is reach out and ask that direct question. My own feeling is if I were a client advocate, I would direct folks to use the services and the tools that Jess identified, but coordinated care organizations are supposed to be a vehicle for sharing that information and making sure folks are connected with providers who are going to work for them.
Yeah, I mean, I want to agree with you, Ellen. And I think what often happens is the CCOs give people our phone numbers at our programs, which I love. We've worked hard to be like, we vetted the way that we've had to vet providers. I trust the opinion and experiences of another trans person way more than I trust the opinions of most people. I mean, not in general, maybe sometimes in general, but the experiences of, I saw this doctor, and if I went to say to somebody to say, I'm looking for a new primary care doctor and I live in Redmond, Oregon, where do I go? I want to know from another trans person to say, I went to this person and here's why they were great, because it's going to be similar stuff that I'm looking for. Because it's not just about, did they get my name right? Did they get my pronouns right? But it's like, how did they ask me questions? You know, when I brought up, if I bring up something like hormone therapy or surgeries, or do I see them actually like flinching, you know, or shutting down, or did I come into the front door and they said, we're glad you're here, and not, we can't serve you here, right? Is calling the OHSU program, calling our program. We have a patient navigator, Cody, who I swear is the sweetest person ever to work on a phone. And they love talking to people. We do matching similarly, like what OHSU and what our programs do is we match people as best we can with, do you have health insurance? If yes, we try to match you with people who take your health insurance and have room on their panels, like can actually take a new patient. And it's going to be the closest fit possible. Even if you're like, hey, I live in LeGrand and I need a psychiatric nurse practitioner because I need some meds done. I wish I could say, yeah, you could go to Annie's psych nurse practitioner, and that we're not there yet. So we try to keep lists even that it's, for me, gender affirming care isn't just right about surgeries and hormones. It's about 1,000% of my healthcare. And we pay very close attention to that and keep those lists. Community members, if you're on Facebook, there are a lot of different Facebook groups. Transgender Oregon Network. If you're in Portland, there's Portland Transgender Community. There's like so many groups where you can ask the opinions and experiences of other people and reach out to those folks, because I think our peers can be really great resources for that. Yeah.
Jess and then Amy.
Just to build off of what Hayes said, if you are a provider on this call or a friend of a provider, as it potentially becomes less and less possible for people to travel greater distances, the statement of "we don't do trans care here" is just unacceptable at this point. We don't want just anyone hanging a shingle because, as Hayes identified, it's not just about figuring out how to provide hormone therapy, although that is certainly a much needed service in many areas around the state. It is about that sort of cultural transformation of a practice or a system. But there are resources out there online through, Project Health and Transline for consult-based stuff, through the National LGBT Health Education Institute, where people can get some baseline knowledge and hopefully get inspired and less afraid to do this care, because we need more providers outside of the metro area and some other hotspots.
Thank you, Amy.
I would also add, for anyone who picking up the phone and calling is not feeling like the best way to get help, we did start on our transgender health program website something called a service request form. So you can send in a request form to us. It asks for your name and your phone number and email address, what you're looking for, where you're located, what kind of insurance you have, if you have a primary care provider or not. And when you send us all that information, we can reply via email to give you some guidance. So for anyone where the phone is not really how you want to proceed, we do have that as an alternative. And the more details you give us, the better we can guide you with specific referrals that might be a good match for you.
Great, thank you. Next, I have a specific question around the application process for OHP. So right now, it seems that the applicants are required to choose either an M or F gender marker, which is very challenging for folks who are non-binary. We know that in Oregon, there's over 4,200 people who have an X on their driver's license, and then a lot more folks than that who identify as non-binary, or even for binary transgender folks who haven't updated their gender marker on their legal documents. Can you provide any insight on why you asked the question, how the information is used, and how folks can ensure that their actual gender or chosen name is on their OHP record?
I can answer part of that question, and my colleague David is going to answer the other. The system that providers and plans use, that we use as a state, is called Medicaid Management Information Services. In that system are over 1 million people, everybody who currently has OHP and everybody who used to have OHP. And I had a client who came to me and said, I want an X, just like I have on my driver's license. And I learned that our system does not have the capacity to put an X in the gender orientation in the Medicaid Management Information System, which is, again, the system that providers and plans use to understand somebody's eligibility and what plan is covering them. I do want to say that we have a new MMIS system that we're aiming to get, and when we receive that, this information or that gender demarcation will be able to be included. The good news is something that David's going to share as we head towards integrated eligibility, which is the front end of the process.
Great. David, I'd love to hear from you.
Sure, thank you. So we're updating our eligibility system shortly, and we're going to change how we're asking that question on the application. So, an individual's sex is collected in the eligibility determination process mainly for data matching purposes with the Social Security Administration. It's collected both on paper and online, and is currently asked as sex on original birth certificate. However, the question will be changed for our new eligibility system. And so the applications in the online system will be updated for data matching purposes, what was your sex assigned at birth? And this was a recommendation that was produced from a sexual orientation gender identity committee. And that's a joint work group, which includes representation from some state agencies, including the Office of Equity and Inclusion, as well as DHS and OHA. And then there's also a group of external stakeholders. So that's kind of the other part from a system side that we're trying to change how it's being addressed.
Great. Thank you for that. And another OHP question, folks who had private insurance who are shifting to OHP due to losing their insurance through losing their employment. They're wondering about if they had surgeries canceled or scheduled with their commercial insurers prior to losing their coverage, what the process is once they've moved to being covered by OHP.
So this is David again. If you're moving from a private insurer to an Oregon Health Plan insurer, there is going to be a transition process. You're going to need to work with that coordinated care organization, and you're going to need to get connected into their network to see how you can access that same surgery. If you're moving CCO to CCO, and that would be more in an event that you were changing locations potentially, then there are some guardrails in place to help members have those appointments or surgeries kind of handled in a different way. But moving from a private onto the Oregon Health Plan, going to need some contact with your coordinated care organization to help set that transition up.
Great, thanks. Amy?
I would add that if you are already kind of in the established in care with any of our systems, we will not say that you have to start all over again because your insurance changed. We just want to make sure that if you have already come in for a consultation or if you're getting ready for a surgery, is to please call us and update your insurance information so that our staff can then reach out to your new health plan to submit the documentation of the care you've already received and work on the prior authorization process with your health plan. You do not need to start over and have a new consult. We'll pick up with your change and keep moving forward. And if there's any issue of mismatch, we'll work on that with you. I think the biggest implication might be in the primary care setting where you access your primary care, but the surgical and specialty care we'll just pick it up with your new insurance and work with you on that.
Great, thank you. We have another question for OHA, which is, can you give us a brief overview of the process to apply for OHP and the top common mistakes that could get someone's application delayed?
Yes, I can help address some of that. So the process right now is an application process. You can Oregonians have several options to apply by. There is an online system that you can access called the applicant portal. There's also a paper application that you can fill out. You can archaically, you can fax that in, You can also send it to your nearest DHS office and drop it off there, and they will mail or fax it to OHP as well. Also, you also may have access to community partners who can also help you apply in person or over the phone as well using the applicant portal. They're a great option for folks if they have questions about what they need in advance. It's a really great team that's all over the state, but there is a large group in the Tri-County area up there as well. And there are many folks that help people apply every day. You can also call the Oregon Health Plan, and they can have an eligibility worker help you apply over the phone via the worker portal. I would say as well, there are plans in place to help bolster that process, and we are looking at the potentiality that there's a larger amount of people looking to apply because their income's been affected by COVID-19. So we're really trying to put in some operational support systems. So if we get influx of people looking to apply over the phone, we can kind of supplement that team and help that process out. There are reasons though why applications can get delayed, and some of them can be pretty easily avoided. Some of them may not be things that a member or a potential applicant has access to. The first and foremost is just not providing all the required information. On the newest recent paper application, there are asterisks now on certain areas where those are the questions that must be answered, meaning we need a response to those. Some of the questions are going to be more intuitive. If the answer is yes, then there's supplemental questions that will need to be answered, and those wouldn't be asterisked unless necessary. Also, you need to provide as accurate information that you have access to when it comes to income. That is one of the big hurdles when we have potentially an inaccurate picture connected to income. Not submitting your proof of income as well as self-employment income proof along with your application. Those can be some hangups, as well as just incidentally not signing the application. We do have instances where people just don't sign it, and that can be a small thing that will definitely cause issues down the line. There's also some other supports that we're working on to help members as they apply to make it easier to apply, and I think that we'll have more information on that stuff soon.
Great, thank you so much for that. That was really helpful. I'm going to take a brief pause to give two announcements. One is there is a link to, there's a donation link that should be up in the town hall, and that's for making sure that this weekly meeting stays accessible. We have live captioners who are doing an amazing job, and we would love to keep them employed with us every week. And so if folks could chip in a few dollars, that would be super helpful. And we still have about 15 minutes, and we have time for a few more questions. So feel free to put them through Facebook or through the YouTube comments. And then I have sort of a question for everybody. I know you're all amazing advocates, and I think that especially for the LGBTQ community, and maybe in particular, especially the trans community, a lot of people are stuck at home right now with unsupportive family, and maybe facing financial instability, and of course possibly having healthcare delayed. Can you give some suggestions for folks about taking care of their mental health in this moment, and maybe something you would tell folks who'd call up your programs, and just some simple suggestions that people can do at home to really take care of themselves during this time?
Well, this is Ellen. We've heard about many ways that people can hopefully engage themselves in other activities. And I think this kind of a meeting and gathering, which I've heard about from others, being able to see somebody, each other, members of your community visually, is one way to kind of keep, as our state agency has stopped using the word social distancing and started using the terms physical distancing, because obviously connecting socially is really important. Really want folks to know that their plans are there for them. There is mental health parity law in place thanks to advocacy efforts. And I really truly believe that folks need to use this opportunity if they feel they need to connect with a mental health provider. And if you are in a coordinated care organization, you would call that plan to find out about neighborhood providers. So those would be my suggestions, and I really appreciate that folks are asking about it.
I think that there's nothing like being in a household with people who use your pronouns or call you by your name, or the opposite of who refuse to call you. It's a special kind of hell to be in, you know? So I think a few things. One is there are a lot of trans people like me who work in places like a healthcare system, who, when we answer the phone, you're getting a person who actually, when we say, yeah, I know what that's like I actually mean it, right? It's like actually having that experience, which is, I think, a powerful thing. So I can say, yeah, yeah, I've experienced that too. It's, I don't mean something like it. I mean, like, yes, I've been called the wrong pronouns by my family forever, or I still have so many people in my life who won't use my newish name, you know, or wanting to, so many of us take opportunities when we can to express our gender, you know, in the clothing that we wear, or doing your hair, wearing makeup or not. Like, there's so many things that we do, not just for ourselves, but sometimes to help other people see us and know who we are. So I think a couple of things. One is, you know, accessing services like Trans Lifeline, which is a mental health hotline that is staffed only by trans and gender diverse people. So using resources like that, so you'll get other folks on the phone. Two is, if expressing your gender through makeup, hair, or wearing different clothing is something that you would usually do, is it's okay to do that for yourself too. You know, is it's okay to do that for yourself. And I want to encourage people to, like, find your outfits, like make your plans of, like, okay, as soon as I can go hang out with my friends again, this is the outfit that I feel fly as hell in, you know, or getting to that place of where you can take a picture of yourself and then look at yourself and then do it again the next day. Like, finding those things where you can see yourself in yourself, finding those people who you can talk to online. You know, this is the thing I think a lot of people know about trans folks. I almost said for centuries, but for decades, we have been finding each other online and supporting each other, which is the only reason the centuries joke was, like, I was like, my brain went to centuries. And I think it's just because the month of March felt like 5 years long. So, but I think also, you know, we've all found each other online for so many years, for so long. When we didn't have public support groups hanging out in LGBTQ community centers, we were online talking to each other, and still are. So knowing that there's a lot of groups where you can also talk to each other and say, I'm having a hard day, I'm struggling with this today. And third is, where you can, humor, make a game of it. There are so many, I grew up in the South. There's still so many people who call me ma'am. They're like, yes, ma'am. And I hear them say, I usually say, who are you talking to? And they're like, you. And I was like, no, you said ma'am. And they're like, no, I didn't. I was like, did you? Did you say man? Did you say ma'am? And then creating this little game of confusion. It's fun for me because then I get to see somebody squirm. Not gonna lie. Sorry, not sorry. it's finding a humorous moment when you can, and it's not always possible. I think a lot about youth who school was the safe space. Like, every day that I wake up, I'm thinking about young folks across everywhere, where like where school was your place where that one teacher would use your pronouns or use your name. And I want to say that we're thinking about you. We see you. We want to talk to you on the phone or email you. We'll send you coloring sheets, or we'll send you artwork, or we'll send you Instagram accounts of people who are trans in the world, and finding inspiration in that to, you know, hang out with us for another day.
Thank you, Hayes.
Yeah.
Jess, love to hear.
Yeah, just to speak additionally to the young folks or their adult support people who might be out there. You matter. We see you. We are committed to you growing up into your potential and taking over the world and making it so someday we don't have to have these calls. And as far as like tangible resources, there is Trevor Space, which is largely LGBTQ online space for folks under 25, where it's kind of like a chat room and monitored by adults to prevent trolling and things like that. But they also have a crisis support aspect through the Trevor Project as well. And there's both a text, a chat function, and a hotline that folks can call. Locally or through Oregon, Transactive Gender Project has been around for years and years, and they have moved all of their support groups online, and definitely get in touch with them. And as Hayes said, regardless of your age, please reach out to us if you just need someone to talk to, and if there is a specific resource need, we'll plug you into it. But it's finding those little things. And I will just share that I identify as someone who has a history with mental health struggles, and this week has been good. The prior 2 weeks, not so good. And so I have such gratitude for the fact that I have social resources, but I've created agreements with a couple other people that I know will fill my bucket back up. And so if you do have those folks in your life, first and foremost, hear that you are not a burden, and that they are probably needing that connection just as much as you are. So if you can make those agreements to check in with each other, or send funny memes, or send a picture from the bathroom where you're wearing the hat that you love that makes you feel like yourself, or you showered today, or whatever, do what you need to do. Take it minute by minute if you have to, breath by breath, because as long as we're breathing, we're living.
Thank you for that, Jess. And yeah, it feels like no one's having their best life ever right now. And that I think for a lot of us, it's taken a long time to realize that it's just this really scary time, and that it's not just acknowledging that, but just letting ourselves feel a little bit of that fear and despair of what's happening right now, and that we're not alone in this. And around the world, people are feeling this, and yeah, it's really hard. And I just really appreciate all of the wisdom you've shared, and from your direct experience, and and all your advocacy over the many years. And it's been really helpful. And additionally, I just also want to say thank you to our friends at Cascade AIDS Project and Prism Health, who've been actually answering a lot of specific questions that people were writing in the chat. So thanks for that. And so I'm going to actually open it up to see if folks have any closing comments that they want to make in our last 4 minutes. Looks fairly quiet. Oh, go ahead, Hayes.
For folks who are tuning into this, who have some amount of wealth privilege or have job security, I know for myself, my stimulus check landed in my account today, and I want to greatly encourage folks who have that amount of like privilege and capacity in your finances or your income to redistribute that to a variety of places. If you're on this call because you have trans people in your life or you're a healthcare provider, is putting those funds toward, we have over 6,000 houseless people in the city, in the metro area of Portland. So many of them are trans and gender diverse, they are intersex, they are queer, could use some additional help right now, or some of the agencies that are helping people are really, really stretched because they're having to make so many changes to be responsive to the pandemic right now. So I want to urge you to think about doing things like that, is like finding ways to redistribute that to other folks who are really getting hit hard by so much change that is happening right now. And if any of you who are listening who are trans and gender diverse folks, please spread the word that there are some new, if you're a Portland metro area, that there are 3 new tent cities that are opening for houseless folks who have not been able to get into shelters because the shelters have limited capacity or letting folks in. And there is a space that is prioritizing LGBTQIA people in that space. There are intakes happening right now. If you want a safer space to sleep with other people, get food, get healthcare, and take care while the stay-at-home orders are happening.
Thank you for that, Hayes.
Yeah.
I just want to say thank you to Nancy and Basic Rights Oregon and to my colleagues who came together this evening to talk and offer resources and support. Appreciate the opportunity to be here and connect with our listeners. I also want to say that we keep inviting you to call us, but I also want to just let you know that at least for OHSU, Jess and I are both working remotely and having just some small amounts of time coming into the office. So if we don't answer the phone right away, we are still listening to your messages and we're still calling you back. Don't despair if we don't pick up the phone on the first ring. We always return our calls. We will call you back. Sometimes we might be calling you back from a number that isn't an OHSU number. So be patient. We will get back to you. We do want to talk to you and we do want to hear what you have to say.
Thank you. And I just want to say next week we will focus our Queer Town Hall on meeting other basic needs, housing, food security, and maybe even some more specifics around OHP. We don't know exactly what it's going to look like yet, but we've heard you and we know that you all have a lot of needs and we want to give you all the answers we can. And again, I just want to thank our amazing panelists and thank you all for tuning in, and see you next week. Take care, everybody.